The following are the events which occurred on the memorable date of June 17 in 1982. By Sister Margaret Mary and Meta AI. Here is a rewritten account of Sister Margaret Mary's experience with Father Paul's coronary bypass surgery in 1982. In May 1982, Father Paul underwent a heart catheterization at the Cleveland Clinic, which revealed the need for coronary artery bypass surgery. He was placed on the waiting list and eventually received a call to undergo surgery on June 17, replacing a patient who had been canceled. On the morning of June 17, Sister Margaret Mary and Sister Mary Rose Mullin arrived at the Cleveland Clinic to support Father Paul before his surgery. They were joined by their niece, Pat Lash, and later by Clem and Thelma. As they waited, they prayed fervently for Father Paul's successful surgery and recovery. At 9:40 a.m., Father Paul was taken to surgery, and after several hours, he was taken to the intensive care unit, ICU. However, due to complications, he was taken back to surgery at 3:50 p.m. and then returned to the ICU. The surgeons, Dr. Cosgrove and Dr. Gorgopoulos, updated Sister Margaret Mary on Father Paul's condition. Over the next few days, Sister Margaret Mary and Sister Mary Rose Mullin visited Father Paul regularly, observing his progress and struggles. On June 18, Sister Margaret Mary attended a class on intensive care and later visited Father Paul in the ICU, where he was asking for water but was not permitted to have much due to his condition. Father Paul was eventually transferred to a post-cardiac surgery unit and later discharged on June 30. However, his recovery was not progressing well, and he was readmitted to the Cleveland Clinic on July 9. Throughout his hospital stay, family members and friends visited him frequently, despite his weakened condition and deteriorating vision. Coronary artery bypass surgery in 1982 was a major operation that involved grafting healthy blood vessels to bypass blocked coronary arteries, restoring blood flow to the heart. The surgery was a significant procedure, and the recovery process was often lengthy and challenging. This account highlights the emotional journey of Sister Margaret Mary and her family as they navigated Father Paul's health crisis, showcasing their love, support, and trust in the medical team and the power of prayer.